Kidney stone is actually a crystal that forms inside what we call the collecting system of the kidney. It's the drainage tubes that come from the kidney. And it starts off as a little nucleus, a little crystal forms, usually made of calcium and another product that come together. The urine has to be what we call supersaturated, and this little nucleus forms, and then your body deposits more and more materially on this little nucleus, and it forms a crystal. Looks like a rock, looks like a stone, sometimes has really sharp points on it, sometimes it's smooth, but actually forms in the kidney, and it can vary in any size from 1 millimeter up to 10 centimeters. Kidney stones are silent until they move. If they're up in the kidney itself and they're not blocking anything, we don't know they're there. It's only when they roll down into the drain pipe, so to speak, of the kidney and plug it up and cause the pressure to go up in the kidney, that's when we sense their presence. So the symptoms of kidney stones are, number one, very intense pain. For instance, women who've had children, who've had babies, say they'd rather have a baby than a kidney stone because it's so painful. In addition to the pain, it also generates nausea, sometimes vomiting, and the pain is so intense that it usually makes it necessary to visit the emergency room to get pain medication. You can't just handle it, you can't tough it out. Most people don't. Kidney stones form for a variety of reasons, but one of the primary reasons is people get dehydrated over a long period and their urine becomes concentrated. The components in the urine build up and they're more likely to precipitate out if the urine is concentrated. So that's one very big factor. Other factors involved are that certain people absorb more calcium from their diet than others, and so their calcium levels are higher in the urine. Other compounds that can accumulate at higher levels that can cause kidney stones to form are uric acid. That's another component that's derived from meat products. Other factors that can be involved are what we call the pH of the urine. It can be too acidic or too basic, and that can predispose to kidney stone formation. So there's a lot of different factors involved. One way you can avoid kidney stones, or try to avoid them, is to keep your urine dilute. If urinary hyperconcentration causes stones, then the opposite, keeping urine dilute by drinking more fluids, makes it less likely for those salts to precipitate out that form stones. If for some reason you are an individual who absorbs more calcium from their diet, you can try to decrease your intake of dairy products and things like that. If the reason you're forming stones is because there's too much uric acid in your urine, you can try to decrease your meat consumption. If the pH of urine is a problem, then you can take medications, or you can even, one way you can change the pH of your urine is to drink more lemonade. It causes citrate to form in your urine, which changes the pH and also helps to effectively remove calcium from the urine. So there's several different things you can do to try to prevent kidney stones. There is a predilection toward men. About 10% of men will get kidney stones over their lifespan, about 7% of women. But what may be even more important is that there's another factor that will increase your chance of developing kidney stones, and that's your weight. Being overweight makes you more likely to develop stones. About 11 to 12% of patients who are overweight develop stones, as opposed to about 6% of patients who are normal body habits. So that is one way you can try to decrease your chance of developing kidney stones. One is to simply try to let it pass, and that in certain respects is probably the best way to get rid of a kidney stone. If it's relatively small and you can get it to travel through your ureter, of course you don't have much control of it, but if it does pass out spontaneously, then that's probably the best way to take care of a kidney stone. Other options are, if it's too big to pass through the ureter and get stuck, then you can either use what's called a shockwave treatment, or you can go into the ureter with a scope and try to break the stone up with a laser and try to remove the fragments with what we call a stone basket. So those are the primary options. The shockwave lithotripper is a machine that was developed back in the mid-1980s for treatment of kidney stones, and it was revolutionary in its way of treating kidney stones. It's a machine that focuses high energy shock waves on the stone and breaks it up into sand, and then the sand passes through the ureter much easier than a 3 or 4 or 5 millimeter stone would pass. There is another option that's not used that often, and that's called a percutaneous nephrolithotomy. And basically, that's for larger stones that are up in the kidney rather than down in the ureter. And those stones are too big to be treated effectively with shockwave. And what you have to do is you have to put a small tube through the skin into the kidney initially, and then stretch that opening out and put a scope into the kidney and break up the stone with an ultrasonic device, break it up into sand, and then actually remove those fragments with suction. It's a pretty good way of eliminating large stones. It's more invasive than going in with a scope in the ureter, and it's more invasive than the shockwave lithotripsy that's used for ureteral stones and smaller kidney stones, but it's very effective.